Welcome back. While early childhood development centers provide more than just education for young children, they also provide safety, supervision, as well as nutrition. In poor communities, these centers are critical, but they are poorly funded, with many struggling to survive. So let's discuss what can and should be done with Dr. Catherine Draper there from the Developmental Pathways for Health Research Unit at Wits. So Dr. Catherine, thank you so much for your time this afternoon. Just paint us a picture, really, in terms of some of these centers, as well as some of the realities they're confronted with on a daily.
Good morning. Thanks for having me. So we did a small research study in Cape Town just to really capture what some of the principals of ECD centers, how they felt about the impact of the pandemic. And as you mentioned, they provide such a key service, not just in terms of early learning, but in terms of providing a place of safety, a nurturing and supportive environment for young children, and also meeting many of their nutritional needs. And what we found is that, as we know, the ECD sector is already very fragile. It has quite limited government support already. And so it was quite ill-equipped to deal with the shock of the COVID pandemic. And while many of them have found ways to recover, have reopened, there's just numerous challenges that they still face and still needing more support. And as you may know, many of these centers rely on fees from parents and caregivers, many of whom have also been affected by the pandemic in terms of financial challenges, loss of jobs, all those kind of things. So there's just many knock-on effects. And obviously these principals, the ECD practitioners, are many incredible women, mostly women around the country, that are really serving the needs of these young children, setting them up for their school career, setting them up developmentally, and they show this incredible sense of responsibility and resilience. But that really doesn't fill in that gap in terms of a bigger and more systemic support needed for the sector.
Yeah, I mean, we've been having ongoing conversations around moving ECDs to the Department of Basic Education so as to formalize the sector more adequately, as well as to provide the adequate resourcing, as well as teaching and training to those staff members that are working in these ECD centers. Why do you think the process is taking so long, Catherine?
I'm sure there's many other people that could comment on the process a lot better than me, but I think because the sector is so vast, and I think because there's many systems that haven't yet been put in place in terms of providing the financial support, providing career pathing for these practitioners, and really taking the burden off parents and providing more systemic support. And I think it is also difficult to understand, what are the key things in terms of development at this age. And it is around early learning, and it is around academic learning. But there's all sorts of other aspects of development that children need to grow in this area, particularly in these pre-primary years, things like motor development, things like social emotional development. So, and obviously their health as well. And so it is, in many ways, early childhood development spans across a number of sectors. And so I think trying to cleanly fit it under one sector is quite difficult. And that is probably potentially why it has taken so long in terms of understanding all the broad range of developmental and health needs of children at this age.
Yeah, but on the other side of it, right, the problems have been further exacerbated by a COVID-19 pandemic. And I'm sure the stop, start kind of mantra that has been the reality for many of us has not necessarily helped either with being able to sustain some of these ECD centers, the centers where many parents have to leave their children simply because they need to earn some kind of livelihood.
Yeah, and what's really crucial at this age is this establishing these routines and safe boundaries and regular things in children's life, because that's an environment that really helps them to develop well. And so, as you can imagine, with all these disruptions, opening and closing, being at home, not being at home, really does interfere as well with these developmental processes. And some of the principals that we spoke to talked about some of the delays that they've seen in terms of children's early development and learning. We know that the NIDS-CRAM survey has picked up some of the delays in terms of primary school learning as well. And I do think that we are going to see some of these knock-on effects in years to come. These form the foundational years for children's primary and secondary school education. And if that is disrupted, it would be naive to think that we aren't going to see some effects of this later down the line in terms of where there have been gaps not just in terms of learning, but in terms of routines, things around their activity, around screen time. We've also done some research around that those are some of the key areas as well that have also seen an effect. And all of those come together to affect these children. And if we see challenges around literacy and numeracy later in school, this is where the building blocks are put in terms of those later academic skills. And there just really is a need to focus much more intensive attention and finance and support for these early years.
Yeah, I mean, you're speaking about the knock-on effects. Many would say that South African children are already feeling it, and it could potentially get even much worse. And we'll ask you about exactly how much worse could it get. I mean, as we're saying, the statistics are showing, Dr. Catherine, that about is it 75% or so of children in grade 4 cannot read with comprehension, right? 9-year-olds can't read with comprehension. If these kinds of building blocks are formed during early childhood development, as well as the role in which development centers can play in ensuring that children are able to foster some kind of a routine and some kind of an introduction to perhaps the greater sphere out there, how much worse can it get, really, when we're talking about children's ability to learn, especially when they get into formalized basic education?
Well, I guess one doesn't want to paint too dark a picture, but I think we have to see how all these systemic challenges in our country are connected. So if children are really struggling at school, there's a likelihood that they may be more inclined to drop out earlier at school. So they're not completing their high school. Are there systems in place to help support, to catch those children who are leaving school early? So when we look at things around unemployment, limited job opportunities, all those kind of things, these are the things that, that much further down the line can actually affect those things. And I think we also need to just be aware that only around 2/3 of children of a preschool age are actually attending some kind of ECD service or center. Sure. So there's a high proportion of children, if you look in terms of absolute numbers, of children who are not at any kind of preschool, who are not attending a creche or an ECD center. And they then essentially start grade R without any of those building blocks. And there's many amazing ECD organizations around the country that really try and fill in that gap and work with caregivers, play groups, all those kind of things. But if there's a barrier of parents not being able to afford to send their children to an ECD center, then there's a whole other group of children that we have to think about in terms of are they getting those building blocks? Are we setting them on the right trajectory for their development, for their academic success, and ultimately success later in life?
All right. Well, we have to leave it there, unfortunately, for now. Dr. Catherine Draper, the Senior Researcher at Developmental Pathways for Health Research Unit, and that is at Wits University.